I look around and I see I'm my brother's keeper. Yancey County for Obama. Show me the health care. Health care for all. 52 million Americans don't have health care. Civilized people care for each other. You know, every other country that's civilized has health care. We're talking about getting in 2009. Let me read you something that was said by a U.S. president. The health of American children, like their education, should be recognized as a definite public responsibility. One of the rights of every American should be to right to adequate health care and the opportunity to achieve and enjoy good health. Every American should have the right to adequate protection from the economic fears of sickness. We should resolve now that the health of this nation is a national concern. Financial barriers in the way of attaining health care should be removed. And the health of all the citizens of the United States deserves the health of the nation. Who said that? Harry Truman. November 19th, 1945. Folks, we've been trying to get this for 63 years. Does anybody think it's time for national health care? President Truman said the idea should be people pay a little bit and the government takes care of the health bill. We take care of children. We take care of folks that don't have health care. We take care of children and we fulfill our potential as a superpower country. That was his idea 60 years ago. We're past due, folks. But we have an opportunity in 2009 to get this through. We can join the rest of the world and have health care for every single American. We have a leader that many of you helped elect, President Obama, that has proposed a plan that's going to make this happen. He's leading from his head and his heart. Here's how he's going to do it. We got to reduce the cost. Did you know that half the bankruptcies in the United States have some element of health care bills involved in the bankruptcy why they can't pay their bills? Did you know that uninsured people are 50% more likely to go to emergency rooms and get the highest health care possible than people that do have insurance? And did you know that every person that has insurance pays an additional $1,500 a year to cover people who don't right now? Now that's our current system. And Paul's right, it's broken. We got to fix it. President Obama also wants to guarantee choice for everybody that has health insurance and everybody who's going to have it after the plan goes through. Every American should be able to choose your plan and choose your doctor, no matter what. You can't penalize people who already have health insurance, but you've got to make sure that everybody has it. And then President Obama is going to insure health care for everyone. I've heard 46 million, 52 million. There are a lot of folks out there that don't have health care. You know them. You may not have health care. And that's not an acceptable situation in a country that has the money the United States of America has. In Buncombe County, 11% of children and 20% of adults don't have health care. In North Carolina, 60% of people who don't have health care are working part-time or full-time. So it's not a situation where you have folks that are sitting on the side of the road. It's me and you. And of the people that don't have health care, 58,000 in North Carolina, their spouse is working full or part-time. So this is a problem that cuts across all economic boundaries. Now, Buncombe County, we're trying to do our part. We have a good health care system here. We're one of the few health care systems in the country that take all comers. We take everybody. We had 9,300 people in our health care system. And next year, we're going to try to get it up to 15,000 because we're going to do some partnerships that's going to change that. So while we're trying on a local level, It's got to be a national program. There's so many economies of scale. There's so many other benefits to having a buying power of millions of people instead of thousands of people. It's going to work better. We've got to support our president. What can you do? The first thing you can do is get up on a Saturday morning and come out and get some information. That's the number one thing, and you've done that, and I bless you for doing that. Every religion in the world has part, whether you're Christian, Jewish, Hindu, Muslim, whatever, there's parts of it that talk about taking care of people that don't have as much as you do. Take care of your fellow man and woman. Help them. Good Samaritan. Help them when they can't have the health care they need. Make sure of it. Support the single payer. That's the only way it's going to happen, folks. We've got to have it. And a lot of the insurance companies that have said for years, government couldn't do anything right. They couldn't compete with business no matter what they did. They're the ones that are going to have mom and pop on TV saying, oh, please don't let the government compete with us. That's going to be a tough thing. The hypocrisy is pretty deep here. Let's have the government as a fallback, as President Obama talks about, and let's keep it going the way it is, but have a single payer and make sure that everybody is covered. Talk to Kay Hagan, talk to Richard Burr, talk to Heath Shuler. I don't think Burr's on board, but I think Shuler and Hagan are. You get them on board then. You write them. You tell them it's a big deal to you. We've got to have this, folks. And we have a historical opportunity in 2009 because we got a good Congress. We got one of the best, probably going to be one of the best, if not the best president we've ever had. And we can get this thing done. Thanks to Paul Troy, Western Carolina for Change, getting people out here. Educate yourself, write letters, get involved, and let's make sure that we become the kind of country we need to be. And that's taking care of people, everybody, whether you have money or not. And if the insurance companies and the prescription companies don't like it, to hell with them. Thank you.
Thank you, Commissioner. Our next speaker is a native of Asheville. She was elected